For many people, the word catalogue conjures up a picture of a shopping catalogue or price list. Whilst there is indeed a need for such lists for pathology, the National Laboratory Medicine Catalogue, the NLMC, goes far beyond this narrow definition. This short video will explain the concepts behind it and describe its intended uses. Over the past 10 years, the world of medicine has become a more complicated place. Not just because of medical advances, but also because the way that medicine is delivered has changed radically. This has been driven by the revolution in IT, which has been transforming the world around us. The internet, mobile phones, cheap computers, and innovative information systems have transformed healthcare as much as they have any other parts of the economy. In the past, health communities worked in relative isolation. A district hospital and its surrounding GPs acted as a local health community. Within that community, information practices could develop safely and consistently, with little regard to what happened in neighbouring locations. With the growing complexity of medicine and the new ability to link and share information electronically, a good deal of care is now provided over networks. These span the existing health boundaries and challenge the freedoms that once existed for local communities to develop independent solutions to how care was delivered and the information standards that they could apply. At the highest level, issues of variance in clinical practice are being addressed by work on standards, for example the National Service Frameworks, and the promotion of nationally agreed pathways of care. It is increasingly recognised that such standards apply equally to all the processes which support care, and not least to the way in which electronic records are created, managed and shared. Laboratory medicine has always been at the forefront of the use of IT in healthcare, and it is not surprising that many of the problems of the use of electronic records are emerging from experience with the electronic transfer of results of laboratory investigations. As data from different sources is combined in different systems, issues of information comparability and equivalence are emerging, which have serious implications for patient safety, cost comparisons, quality assessment and service planning. For laboratory medicine, which plays such a pervasive role in patient care, these developments have created some unique challenges. One pressing issue is how to standardise the many hundreds of diagnostic results from multiple sources, which may accumulate in the medical record over the course of a patient's lifetime.
I'm Gifford Blackstone. I am a chemical pathologist for part of my time, and part of my time I act as the national lead for pathology within the Office of the Chief Clinical Officer in Connecting for Health. The role of pathology lead is very much about linking the work within Connecting for Health with the work of DH pathology, because as pathology moves forward and we get new models and ways of delivering pathology services, we need to ensure two things. One is that the IT structures we start to develop support new models of working, but also that the information that we store within these IT systems is available for new purposes, both primary and secondary. If I'm in Bradford and my results are in Bath, the people in Bradford looking at my electronic record need to know that that thing that's called a particular chemical name or microbiological name has the same meaning to the people in Bradford as it did in Bath, that the units of measurement are suitable, that they're suitable for comparison with local data. All those things need to be there. And the general term of this is interoperability. And so everything we're doing about the catalogue is about trying to get standardization, because the tighter your standardization, the more liberal you can be using about how you use that data and the number of people that can access it for their purposes.
So what will the National Catalogue do? In itself, it will not solve the problems, but it should be a significant component in the developments needed to solve these emerging issues. It is intended that the National Catalogue will act as a focal reference point upon which other systems can build, towards creating an environment which allows disparate systems to interoperate. It should provide the definitive description of investigations available for use in the NHS, expressed in a common language to allow systems to intercommunicate.
Well, the imperative of moving to the catalogue is very much about things like the summary care record, patient mobility, the GP to GP type stuff, the fact that there are clinical confusions because reference ranges and units of measurement are different in different places. And we have the problem that the research community in particular has some problems because of variations in some of the key factors that are important in things like cancer registries, chronic kidney disease registries and so on.
So how did the catalogue come about, and how is it being created and governed?
Well, what we recognised was that there were lots and lots of catalogues, and there are different groups that had put catalogues together. What was necessary was to have something strong and authoritative that would actually take along the professions as well as users of the service, and to some extent the system suppliers and the reagents companies, that all these changes were necessary and had to come about. So DH has arranged a contract with the College of Pathologists, and they're hosting a process on behalf of the professions to look at the catalogue. Well, we've got the governance board, which is the key factor, and the governance board reports to DH and Connecting for Health. Within the day-to-day working through the governance board, we've got an overall clinical lead, and all these clinical leads were appointed in open competition. And then we've got the specialty leads, and we've got 5 of those, and hopefully soon a 6th. And they are all getting subject matter experts to look at certain parts of the catalogue which are pertinent to that particular individual's expertise. And then we've got the possibility of using a stakeholder group as a sort of sounding board. But once the governance board has made a decision on the recommendations of the subject matter leads and the overall lead, then that automatically goes through to the catalogue, and thence goes out on the 3-monthly distribution to all the people who have implemented the catalogue.
So who else is involved in the process?
That means we've involved the UK Terminology Centre. We're involving NICE around novel tests. We've got a stakeholder group that involves a much wider group of people, pathology users, commissioners, instrument manufacturers, IT system manufacturers. All the relevant people have some sort of sense of ownership of this thing.
Work on the catalogue started in 2009. So what are the timescales for its development and delivery?
The timescale for the catalogue, I think we've got timescales for different sections of it. The first job is to get rid of a lot of nonsense stuff that's in there by using simple editorial principles, getting rid of spelling mistakes that are in some catalogues, getting rid of tests that are no longer should be, by deprecating tests that we shouldn't be doing anymore. Then we've got how do we actually make it slicker for general use. And in a way, while we've got novel tests coming on stream, then it's going to be a live thing all the time. So the idea that it's going to close down at some point, I think, is erroneous, because this has to be a live and growing thing.
That explains some of the backgrounds to the catalogue, how it is being created and how it is being developed. To recap, let's look at the primary purpose of the catalogue and the vision for the future.
The catalogue's primary purpose at the moment is very simply that the reporting and the requesting of laboratory stuff is the same and is universally the same. This is the actual fundamental step of the whole process. We have the same name, the SNOMED code starts us off on the way of being able to message things around the place in a much more cohesive and comprehensive way. And then we add in things like units of measurement, rules for combination of data, reference ranges and so on. Then we start to get something that's much more clinically useful, and of course we can tag the whole decision support mechanism onto the back of that. One of the visions is that besides the primary use of the laboratory data, which obviously is primarily important for patients, there's the whole question of secondary uses of data. And one of the things that comes up is the health service does thousands of natural experiments every day, and we don't know the consequences. So that if I was to ask a question, how many people taking drug A have a change in their serum calcium or whatever over a period of time, actually all that data is available somewhere in the NHS. But if we could actually get all this prescribing information, and then we get the NHS numbers of those patients, look to see what happens in one particular analyte, that natural experiment we can actually do. We can actually pull the data together and see what the effect of A is on B, and that's really important. And maybe a new way of doing research, because this is real life. It's not a randomized controlled trial with all of that complexity and cost. This is real natural life experimentation.
So that completes this first look at the catalogue. If you would like to find out more about the catalogue, you can visit the NLMC website. If you want to get involved, you can visit the Royal College website and look up the Governance Board. If you would like to find out more about related projects, then you can visit the www.laboratorymedicine.nhs.uk website. An accompanying video goes into more detail about the technical architectures behind the catalogue and why it is not simply a version of an Argos catalogue.